You're watching Daytime with Kimberly and Esteban. I'm Karla Salinas, and today we'll be speaking to Dr. Turner Wright all about his balloon sinuplasty technique. And the best part, it only takes 15 minutes. Dr. Wright is a board-certified surgeon in head and neck surgery who tells us this revolutionary in-office procedure opens blocked sinus passageways without the removal of nasal bone or tissue and provides long-term relief for chronic sinusitis.
You basically have 6 big sinuses. You have 2 frontals, left and right, 2 maxillaries under the eyes, and in the back, if you connect the 2 dots, you have 2 sphenoid sinuses in the back. And people go, I don't have a problem with that. Well, a lot of times when the sphenoids bother you, the pain will be referred like to the back of the head or the side of the head. Basically what happens is each one of these 6 sinuses has an opening into the nasal cavity. And the analogy I tell people, it's kind of like a hallway in a clinic, and then you have 6 rooms on the side. And imagine if you had a hole, but in each room into that hole, and so you can stick your arm through each one of those things. Now, all sinus surgery is over time, those holes can get smaller and smaller to the point where they occlude periodically. They may stop up for a day, a week, and then reopen for a month. But the holes basically have become so small that any type of inflammation, they occlude. So once they occlude, the patients build up pressure. And what we were talking about earlier, pressure is pain.
Dr. Wright tells us procedures like these have come a long way throughout the years, and now the balloon sinuplasty provides patients with a safe procedure with accurate results and fast recovery.
Now, the balloon basically goes into the opening. You inflate the balloon, and that opens the opening in an atraumatic way, and that's why we're able to do them here in the clinic. Patients tolerate them very, very well.
This procedure will have you breathing right, so make the right choice today.
And so basically, the goals after a nasal sinuplasty are to relieve patients from getting the severe pressure pain, which could be in the back of the head, or we mentioned. The other part of the procedure is reduction of turbinates, where I go in and I basically use a coblation needle to reduce the diameter and shrink the turbinates. The goal of that is to make you breathe better so you don't get stopped up. So you're looking at a procedure that takes minutes. You don't have to take a day off. You don't have to pay the hospital. You don't have to pay anesthesia. You don't have to be exposed to a lot of people having your surgery done in the clinic. And the goals of the surgery are to relieve sinus pain, pressure, infection, nasal obstruction. The success rate is very, very high. I mean, it's very high. And the surgery is very minimally invasive.
Schedule your appointment with Dr. Wright at 956-998-6673 or visit wrightsinuschoice.com.